Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the World Health Organization warns on the timing of the new alert level system in Metro Manila, but the government is keen to place the entire region under alert level 4 starting Thursday. Also, as more businesses and activities now allowed under the alert level system, the Trade Department says hundreds of thousands of workers may be getting their jobs back. MMDA Chairman Benhur Abalos joins us live. And later, amid Davao City Mayor Sara Duterte's declaration that she will not run in 2022, a group remains unfazed in convincing her and President Duterte to reconsider their 2022 plans. Hugpong ng pagbabago spokesman and former Davao del Norte Governor Anthony Del Rosario tells us more live. The government is recalibrating its strategy to revive jobs and livelihood. Our Caroline Bonquin asks the Health Department about the science and logic of this new lockdown scheme.
Almost 21,000 people got COVID-19 every day in the past 7 days, double than the peak of cases in April. Based on government's data, about 18 out of 100,000 people are getting sick daily. Many hospitals and quarantine facilities remain near or at full capacity. 12 regions are at high-risk category. Despite this, the government is shifting to a new policy, introducing new alert levels, which it says could help dampen the number of cases and hurt livelihoods less. Granular lockdowns of barangays or households depending on alert levels. The Health Department's basis, cases are only concentrated in some areas.
80% of our new cases only came from a small proportion of our barangays. Lower cases can be achieved when we improve on our minimum public health standards, case detection to isolation time, and vaccine coverage even at lower community quarantine classifications.
Health officials say vaccination drive is also a factor. While around 2 of 100 people died in Metro Manila last year, it was down to less than 1 this year, as 60% of its population got fully vaccinated. Fewer deaths are also observed among the elderly and health workers this August nationwide.
While we can see that there are more healthcare worker infections and cases in the past weeks, their case fatality rate remains to be low, most likely due to the high vaccination coverage and the protection of vaccines against severe disease and deaths.
But health officials admit there could be underreporting as some deaths are reported days, weeks, or even months later. There are reports of people with COVID-19 symptoms dying at home without getting tested. Some unable to find hospital beds also died at home, which could also delay the reporting. The World Health Organization tells the government to tread carefully in implementing the new policy.
Any changes in the policies result in a further increase in transmission. We need to ensure compliance with the restrictions. If we relax further, it is likely that with such a transmissible variant here, we will see more cases.
Just last week, Philippine College of Physicians President Dr. Maricar Limpin also reminded the government there should be clear and specific guidelines to avoid confusing the public. Caroline Bonquin, CNN Philippines.
The World Health Organization says a significant vaccination coverage in NCR does not justify relaxing restrictions in the region. WHO representative to the Philippines, Dr. Rabindra Abayasinghe, made the statement on Tuesday amid the 60% population coverage in Metro Manila. He said the government must be very careful in calibrating how it responds to the current situation, as any increase in current transmission levels might overwhelm the hospital system. The WHO also gave the remarks after it announced that the country is set to receive 10 million more COVID-19 vaccine doses from its COVAX facility. This is on top of the 13 million doses already delivered to the Philippines from COVAX. On Tuesday, the Health Department recorded over 18,000 new COVID-19 cases. This is lower than the previous day's tallies, as 12 laboratories failed to submit their new data. Of this number, more than 177,000 are active cases. 222 more people have died, while 20,542 others have recovered. Let's go straight to the source of the story. We have MMDA Chairman Benhur Abalos. Chairman Abalos, welcome to the source. Thank you so much for your time.
Yes, Pinky, good morning, and to the viewers, good morning.
So it's all systems go for tomorrow's alert level 4 in Metro Manila. Chairman, marami pa rin ho kasi yung medyo naguguluhan. Of course, dito sa bagong sistema, because nakasanayan na po natin the past 2 months or so, ito pong MECQ. Siguro, just to summarize and tell the viewers, what will change tomorrow?
Well, it's like this, no? Burahin na ho natin about concepts of MECQ, GCQ, etc. It's just like a typhoon, alert levels. The one who calls it is Pag-asa. In this case, isipin na lang natin, it's alert level 1 to 5. Ang nagtatawag, it's at Pag-asa, it's DOH. Ang determinant niya are 2 factors. Number 1, it's the level of infection in the place, kung maraming may sakit. And number 2, it's the hospital care utilization, kung maraming pasyente sa ospital. No? So, tignan lang po natin. Number 1, yung pinaka-magaang. Number 5, yung talagang lahat lockdown. Tapos yung 2, 3, 4, may kanya-kanyang character po yan. No? Pero to make it easier for you, ako iniisip ko lang yung number 2 is 50%, number 3 is 30%, and then of course yung number 4, parang may ano ho yan, may combination. No? But let me go through it. No? Ito munang number 4 kasi ito importante itong Metro Manila tomorrow. So una-una sa number 4, halos pareho lang naman sa ngayon eh. No? Remember that these things are being done to cover 3 sectors. 3 sectors. Yung tatlong C na tinatawag. Number 1 is the covered. What are the covered? Ito yung religious gatherings, etc. Number 2, ito yung closed. The closed are the personal care services, the spas, no, the hair, yung mga hair and nails, yung mga tattooing, derma, etc. And of course, yung close contact, no? Yung mga espanga and closed spaces will be ito yung mga restaurants. No? Ngayon, yung level number 4 with these 3 C's in mind, mahabang listahan yan eh. Ang binuksan lang naman dito ay more or less tatlo lang. Number 1 are the restaurants. No? The restaurants are al fresco, meaning sa labas may hangin, it's 30%, and dine-in, which is 10%, and only those who are vaccinated. Only those who are vaccinated. And also, the workers should be vaccinated. Number 2, hindi lahat ng personal care binuksan. No? It's only 3. It's barbershop, hair spa, nail spa, and beauty salon. Yun lang ang binuksan. It's the same condition. 30% outdoor and 10% fully vaxxed. And of course, no, yung mga religious gatherings, no, mas iba paano, ganun din ang ginawa. 10% and 30%.
Right.
But Pinky, if I might just tell the viewers, yung sinasabi ni Dr. Rabi, kung titignan mo yung bawal sa personal care, mas mahaba, kung babasahin ko kayo, napakahaba, no? Kamukha ng indoor tourist attraction, libraries, archives, museums, yung mga meetings, incentives, conferences, bawal pa rin yan. No? Outdoor amusement, parks, theme parks, bawal pa rin yan. Internet cafes, billiards, amusement arcades, mga gyms, bawal pa rin. Face-to-face classes, casino, horse racing, cockfighting, cockpit, no? Social events. Pagkatapos yung mga indoor courts or venues, all contact sports, bawal pa rin po yan. Personal cares like medical aesthetics, cosmetic, derm clinics, makeup salons, reflexology, aesthetics, wellness, holistic centers, etc. So kung tutuusin mo, marami pa rin bawal, konting puwang
Opo.
lang ang binigay. Yun ang sinabi ko
So-
industriya. Yes.
Yeah, so basically, really, only 3 will open tomorrow. Yun po yung religious activities at 30 outside, 10% inside. Salons, the same way, 30% outside, 10% inside. And restaurants, 30% outside, 10% inside. So you named yung mga bawal po. Kasama po dyan, kahit swimming, bawal po. Hindi ho ba, Chairman?
Yes.
So ibig sabihin,
bawal din po.
just to clarify that, even let's say in maybe condominiums that some people have gotten used to, meron ho kasing sistema na magpapa-reserve ka, yun, bawal din yun?
Bawal din eh. Pinky, kasi itong 2-week pilot na to, we must make sure we must be really very successful here eh. Yun ang importante eh. Kaya bawal po muna, no? Kasi it's not swimming per se. After swimming, yung nag-uusap kayo eh, open eh. Yun ang pinagbabawal dito eh. Yes.
Okay. And then very important here that the public must remember, Chairman, yung pong below 18 at above 65 ay completely bawal pa po.
Well, yung 18, 65 and above, po pwede lang sila if they're going to work or they're going to buy essential items. So
Opo.
will be the pregnant women. No? So tatlo po iyan, yung below 18, pagkatapos yung 65 and above, and the pregnant women. But the 65 and above, and of course the pregnant women or persons with comorbidities, pwede naman if yung pregnant women and 65 and above, po pwede kung may bibilin sila or if essential things or if they're going to work.
Right. Ibig ko sabihin, bawal pa po sila sa religious activities. Bawal po sila sa restaurants at bawal po sila sa salon. Bawal po sila dun sa tatlong binuksan.
Yes. Generally, yes. Except for those
Even
photos, yes.
if they're vaccinated, Chairman?
Yes, yung vaccinated kasi na pag-usapan lamang doon sa mga taong hindi allowed to go out, no? So yung vaccinated only for dine-in, of course religious gatherings kung nasa loob ka, yung 10%, at yung barbershop, yung barbershop, hair and nail spa and beauty salon. Pero kasi generally yung ganung edad, Pinky, bawal talaga except for the two things na sinabi ko.
Okay, and then very important, sir, interzonal and intra-travel is going to be allowed, depending, one must still check on the LGU na kanilang pupuntahan kung anong requirements ng LGU, but generally it's allowed.
Yes, subject to reasonable regulations of the LGU of destination.
Okay, and what about staycations? Bawal pa rin po ang staycations.
Bawal, Pinky. Bawal ang staycation. Yes.
All right. Chairman, we just need to take a very short break. The Source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, MMDA Chairman Benhur Abalos. Sir, earlier in the interview, you said that it's the DOH that will assess whatever alert level Metro Manila will be under. Alert level 4 po tayo bukas. Sabi mo dalawang bagay na kailangan i-consider dito. The number of cases and hospital utilization. Why are we on alert level 4 knowing that the cases are still high, number one, and the hospitals are still full?
Well, that's the assessment of DOH, Pinky, no? Yung kasing alert level number 5, sobra na yun. It's really the last option talagang ECQ na yun, the whole region, just like before. At karamihan sa atin, we do not want to go back to that level, no? Ang sinasabi nila yung hospital care utilization at yung number pa naman, it's just right for alert level number 4. Yun assessment ng DOH.
And what about the concern? I know you had aired the concern of Metro Manila mayors, and we talked about this already, that meron po silang concern on the hospital care utilization. Basically, what it means is if that is still on critical level, which is 70% and above, something like that, mananatili sa alert level 4. Ang sabi po ng ilang mayor, papaano yon kung karamihan naman sa kanilang mga pasyente doon sa mga ospital ay hindi naman nanggagaling sa Metro Manila at galing sa iba't ibang mga rehiyon, and they come to Manila because they prefer being hospitalized in areas in Metro Manila. Was that resolved?
Well, yes, no, tama ka, Pinky, kasi it would be unfair to the LGU kung determinants niyan dalawa eh. The level of infection in your place and the hospital care utilization. So there might be an instance na kung saan mababa ang infection rate mo, mababa ang daily attack rate mo, and yet puno ang ospital mo because it's one of the most premier hospital in the whole country, talagang pinupuntahan. And just because of this, sabihin nila mataas ang alert level mo, all economic activities kailangan i-control, which is quite unfair to the LGU. Yun ang nire-raise ng mga mayors. In fact, I've raised that issue. So ang ginawa ngayon ng Department of Health is that buong region na lang ang ginawa nila pagdating dito sa issue ng hospital care. And not only that, probably binago nila ang how they computed it, no? Baka they gave more premium on the level of infection, no? But I do believe the HCR should also be a factor. Pero dapat whatever will be the factors here should be reflective of what is happening on the ground, no? Kasi magiging unfair sa isang LGU kung control niya pagkatapos maraming ang kaso dahil magaling ospital niya. So siguro even to the extent na malaman din ilan yung residents and non-residents of the patients of those in the hospital, no? So but as where we are right now, it will be based on a metro-wide, no? Hindi na per LGU daw ang gagawin nila.
Okay. What about this, the LGUs? Do you think, are they prepared given that they were told 2 days before the implementation of the new guidelines? In fact, really, the guidelines were released the other night.
Well, yes, Pinky, no, talagang pipilitin na lang namin ito, no. In fact, while we are just meeting on this IATF, we've got a Viber group ng mga mayors. Kaya nagpaikot kaagad ako about survey about dito sa curfew and other things, no. Kaya nagbobotohan kami through the Viber group. We're always keeping in touch. The most important thing tomorrow probably is how to monitor these three activities: the dine-ins, the alfresco, of course, the hair and nail spa, and even the religious gatherings. Kasi titignan mo rin sinong bakunado, sinong hindi, how do you monitor this establishment, etc.
It needs strict
not only that,
monitoring. It needs strict
Yes,
monitoring,
and
Chairman. No?
That's true. So katulong namin dito ang DTI. For that,
Opo. Actually, I wanted to ask about that to follow up on your point. Well, one thing, no, if you read social media, especially Twitter, sasabihin po nila na salons at 30% outdoor. Many are asking, meron ho ba talagang mga salon na outdoor? That's one. Number two is a 10% indoor for restaurant salons who are, trying to stay siguro alive amidst this pandemic. Meron ho bang naging pag-uusap on how's it going to be for these industries? Kasi kung 10% lang po ang bubuksan nila na indoor, paano po naman yung kanilang babayarang renta? In other words, it can come out na baka yung iba hindi na po magbukas dahil malulugi lang sila.
Hindi, no? Kasi ito talaga ang problema is really how to calibrate the economy right now with the health issues. Napakahirap, no? As you've said a while ago, even WHO has said na wag tayong magluluwang, ganito, ganyan.
Opo.
On the other hand, nakita mo maraming walang trabaho, maraming nagugutom, no? Matagal na talaga ito. So how do we calibrate? So ang napag-usapan, maski konting puwang lang, mag-opening tayo, maski konting-konti. So sana maunawaan ng mga nakikinig ngayon. If you're, in fact, let's go through numbers. No? Ito yung sinasabi ng second. Let's say it's dine-in. No? Sabi niya, sa dine-in daw, ang hospital operation, 90% of their operations are in dine-in. No? And only 10% in alfresco. So if you're going to do the numbers, ang dine-in na pinapayagan natin is only 10% of the boxed. So if you get 10% of the 90%, that's 9%. Ngayon, yung sinasabi ni Secmon sa labas, na that's only 10%. At inaalaw natin sa alfresco is 30%. So 10%, 30%, that's 3%. So you add 9 plus 3, that's only 12% of the entire operation of the restaurant kung titignan natin. Hindi lang ang restaurant, kasama na yung mga salon, barbershop, etc. I-assume natin. It really is a small number. And not only that, it's limited activities. It's confined to this talagang maliliit na industriya. Pero what is important sa ngayon is that there is hope, Pinky na talaga mas konti, hindi ba?
Tingnan.
Yun na lang sa anak. No? Oo, sana we must really make this work right now. Oo.
Okay, very quickly, Chairman, yung sa granular lockdowns, bibigyan ho ba ng abiso yung mga granular lockdown? And if so, meron ho bang time frame yon that they must be told that they will be locked down?
Well, yes, the LGUs have really been doing this for the last 1 year. Kabisado na po nila yan, nila barangay captain. No? If there's any level of infection, they've got a formula. Not only in condominiums, no, in buildings, even in subdivisions, if it's just one house, two house, one street, yung isang barangay medyo mahirap na yan, no? Hindi na halos nagbabarangay ngayon, talagang surgical na, no? Talagang tinutukoy na lang. Talagang very strict tayo dyan because ang importante ngayon is in this 2-week pilot, maging stricto talaga tayo. Talagang hihigpitan to. In fact, I myself, I will go around, no? I will be calling on General Sereno to ask, or even Danao, na mag-ikot kami, talagang hihigpitan namin dito. We must really make this pilot work.
Okay. MMDA Chairman Benhur Abalos, sir, maraming salamat po sa inyong oras. Take care, sir.
Thank you. Stay safe.
Thank you. And coming up, supporters still egging the Davao Mayor to run Sarah Run while asking President Rodrigo Duterte to reconsider his VP bid. Hugpong ng pagbabago spokesperson Governor Anthony Del Rosario joins us after the break.